Please come to order. Good morning. Welcome to the Commissioners of St. Mary's County meeting this date, Tuesday, December 16th, 2024. I am Randy Guy, President of the Commissioners of St. Mary's County. I'd like to introduce the other commissioners. Sitting to my right, residing in the 1st Commissioner District, which includes Ridge, Piney Point, Sagers Island, Mr. Eric Colvin.
Good morning.
Residing in the 2nd Commissioner District, which includes Leonardtown, Hollywood, Mr. Mike Hewitt.
Good morning.
Sitting to my left, residing in the 3rd Commissioner District, which includes Charlotte Hall, 7th District, Golden Beach, and Mechanicsville, Mr. Mike Alderson, Jr.
Good morning.
Residing in the 4th Commissioner District, which includes Lexington Park, some of California, and Great Mills, and some of Hollywood, Scott Ostro is caught in traffic, but will be joining us very shortly. Oh my,
Merry Christmas!
it looks like we have a special guest visiting us this morning, Santa. Would you
Merry
like to...
Christmas, everybody! Santa's very busy this time of year, but he has to take time to come visit his favorite commissioners.
That's right.
You've been an awfully good boy this year, Michael. Merry Christmas, everybody! I want everybody to have a joyous and safe Christmas this year. These young men have been working very, very hard for the whole county all year, and I'm so proud of them. Santa's awfully busy this time of year, so he's not going to stay long, but Merry Christmas to everybody.
Thank you, Santa. Thank you, Santa. For being here. Thank you. All right, thanks, Dan, for joining us today. Now, getting back to our official business, seated at the end of the dais is David Weiskopf, our county administrator. Morning. On my immediate right is Julia Birch, our recorder for today. Sitting at the table to my right is our communications director, Jenna Guzman. And our video production team is behind the glass. Please turn your cell phones off or on vibrate. When you come to the presenter's table, please come down the center aisle. And remember, this meeting is being televised, so you need to speak clearly and directly into the microphone for recording purposes. In other words, look good because it's live and on TV. Next, we get the invocation and pledge from the Commissioner Hewitt. Please stand.
Dear Lord, thank you for bringing us together today. As Christmas approaches, we are reminded of the gifts of peace and prosperity we've experienced this year in our community. Please guide and bless our meeting, helping us to work wisely and kindly. May this season inspire us to show compassion and understanding when deciding the needs of our citizens. We ask this in your name. Amen.
Amen.
Please join me in the pledge.
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Commissioner Hewitt. Next, I need the approval of the consent agenda.
So moved. Second.
I have a first and second. All in favor? Aye. Any opposed? Ayes have it. Let's see. Okay. Next, I need a motion to adjourn as county commissioners and Board of Health.
So moved.
Second.
Have a first, second. All in favor? Aye. Any opposed? Ayes have it. Next, we'll have Miss Mina Brewster come forward and, I'm sorry, Dr. Brewster, come forward, the St. Mary's County Health Officer, to give us a update.
Hi, good morning.
Thank you, Dr.
morning.
Brewster. Morning.
How are you all, commissioners? It's a fun, festive way to start the morning. Thank you for your time. This morning, we will have our Board of Health meeting. I'll be covering a couple of different topics. Primarily just some updates on agency business and key health initiatives. I'll then map out some emerging public health issues, and then also talk about upcoming events and community opportunities for our public to consider.
Before we get too started, I want to congratulate you on your award you got at MACO
Thank
for the
you.
Innovation Award for our health center.
Thank you,
Very
sir.
well deserved.
Thank you, sir. We have an extraordinary partnership here in St. Mary's County, as you saw, and you all have been a great, big part of it.
Yes, it was.
And we're just very grateful for all the support that the commissioners have provided, and then, of course, all the support that
It's
our
good to see
community
that we got
partners
that
have done.
award out of 23 counties in the city of Baltimore. Give something like that is a big thing.
Thank you. Thank you. I'll mention it a little bit later as well. Thank you, sir. So our school-based health centers are thriving, and just wanted to remind our community that the school-based health centers are offering both primary care, urgent care type services, but also more recently added behavioral health, counseling, and medication management. And we've had a robust use of these services, actually several hundred new enrollments and patient encounters or visits since our last Board of Health meeting. We are sustaining a very high return to class rate, which is an incredible benefit of having school-based health centers. And fortunately, this benefit is extending not just for the Spring Ridge and Margaret Brent middle schoolers who host this school-based health center on their campuses, but also to all students being seen at our school-based health centers at those two locations. And as you can see, even though we've only been active for some months now with the behavioral health counseling, we've also had some robust utilization of that service as well. We do offer same-day or next-day services for the most part for a lot of these services. For behavioral health counseling, right now we have a 2 to 4 week wait list for that.
So what's the, what's the difference between the top two bullets here, the total enrollments, including behavioral health, and total
Enrollments are the
enrollments
number.
medical only?
Yeah, great question. Thank you for asking. Enrollments are the number of individuals who've signed up or registered with the school-based health centers. In order to be seen at a school-based health center, a child has to be enrolled by their parent, or a community member needs to enroll themselves. And then the total encounters are the total number of visits. So somebody could be enrolled, but might have 5 visits within a
Okay.
given year.
I got you. Yep.
Dr. Brewster, before you move on, when you talk about behavioral health, all right, what are we talking about? Eating disorders? What are we talking about?
Thank you for asking. So behavioral health is actually a more comprehensive term that includes mental health and concerns with things like substance use. And in the context of children, most of the time, behavioral health counseling is tied to mental health in this age group.
Okay, so it's mainly children?
Mainly, for the counseling that we're offering in our school-based health centers, it's mainly children that we're offering counseling to. Thank you. Along with just a reminder that our role in the community is to assess the continuum of healthcare services, to identify those gaps, and work to mobilize our partners to fill those gaps or step in to fill those gaps if that's the appropriate way to handle it. For behavioral health crisis services in particular, we are working on establishing a robust continuum of behavioral health crisis services. These are some of the ones that I've mentioned to you before and we've communicated to our community about. And then if you go to the next slide, Jenna, please. Thank you. Of course, our St. Mary's County Health Hub is an important, critical part of that continuum of behavioral health crisis services. We do offer those walk-in crisis services at the Health Hub. And have continued to do so alongside a variety of other types of health and wellness related services that allow people to have the whole picture of wellness and health addressed. We have now reached over 10,000 encounters thus far across the range of services associated with the Health Hub. That's a huge milestone, and really demonstrates, I think, the trust that our team, right, and that team includes all those community partners that are working alongside us, has built in our community. And we're just very grateful and honored to have that trust from our residents. And we are very grateful and honored for your support and allowing these services to be present in our community.
Well, tell me, of those 10,000, I would assume those are mainly from people from the Lexington Park area since
Actually, they represent the full county. We do have a higher number of individuals from the zip codes of Great Mills and Lexington Park.
Well, since
That's
it's
also the
located
more
there.
densely populated area of our county.
And what
right.
kind of encounters would you say
so-
the majority of them are?
We have they're spread out on a lot of them are care coordination counters. So individuals who are having their needs assessed, and then they're somebody who's working with them to get them connected to the services and healthcare services they may need. We have a variety of individuals utilizing the Health Hub for those crisis behavioral health walk-in services and ongoing visits until they get established into a private provider in the community.
Homeless too, I would assume?
We have some individuals who don't have a registered address that utilize the services there. We have a variety of individuals using the services, though, that have a house or home.
Okay.
Yeah.
Now, Dr. Brewster, of these 10,000 plus encounters, are these unique encounters or are there also?
These are unique encounters, the hub affiliated individuals. So those are the number of encounters, and the number of people that have utilized so far the hub services are over 4,000.
What's a unique encounter?
A unique encounter, I think what Commissioner Alderson, you might have been indicating is this is one service, one point of contact with that individual.
Was their first encounter with the Health Hub, the first time they've shown
Yeah,
up?
so
to
we have
utilize
over,
service?
we have about
First timer, okay.
a little over 4,000 individuals, over 10,000 visits
I
or
hadn't heard that term
encounters.
before, obviously.
Out of the four,
Encounters is more specific because sometimes the service is done in the community with a Health Hub individual meeting somebody at their home. It's not necessarily a visit to the Health Hub, but it might involve a Health Hub program.
Dr. Brewster, out of those 10,000 appointments, encounters, can you quantify how many of those are just people looking for medical services, like a checkup or something may be wrong, versus those that are in crisis?
Yeah, I don't have those numbers off the top of my head. I can certainly follow up with you, sir, and provide that. We have all those graphs that we monitor on a regular basis. We do have a growing number of individuals utilizing the behavioral health services. As word gets more and more out in the community, that's to be expected. So yes, absolutely, I can follow up with that information.
And what is the housing support services that are coming soon?
So we're actually looking to get some workshops in place to help people navigate housing. This isn't placement. We're not the housing authority necessarily, but we certainly refer clients as needed to the housing authority. But it's more for individuals who are looking to identify stable rental units or stable places to rent, to perhaps pursue a mortgage, that kind of thing. So we're looking to get some educational workshops or training in place so that individuals who are interested in that would have a place that they can learn and get those supports. Thank you. Jenna, thank you. And, just again, to follow up, Commissioner Guy, thank you. It was an honor for our team and our community partners involved in the Health Hub to be on stage with all of you in receiving that MACO, the Maryland Association of Counties 2025 County Innovation Award. It's been a tremendous exciting partnership. I feel like it's such a great example of how locals can really get together and get things done for their counties and their community members. And we're just, again, very grateful to all the wonderful partners that have been alongside us every single step of the way. We did the next day, actually, our Health Hub team went to the Maryland Public Health Association to receive their 2025 Outstanding Public Health Program Award as well. So 2 nights in a row.
Wow, great.
Thank you. Our sequential intercept model, and I've brought this up in prior Board of Health meetings, but just to refresh your recollection of that, the sequential intercept model is a national framework that shows how people with mental health or substance use challenges interact with the justice system and identifies key points of intersect where community resources can step in and alleviate underlying risk factors or issues. By using a robust sequential intercept model or system, we can work towards reducing repeat crime, prevent people from cycling in and out of jails, and make sure that they're getting the treatment that they need to stay safe and productive in our community. State legislation from some years ago required local or regional planning around the sequential intercept model. And so our agency hosted numerous local partners, including from our judicial system, to discuss opportunities to address substance use disorder or mental health concerns where there might be points of intersect with the justice system. And then the next slide, I know it's difficult to read, and I have plenty of handouts if
A lot
you're
going on in that slide.
looking just like, yeah. And this is more to indicate, to give the impression, because it's certainly true, through our mapping process, we realized that we have a very robust system here in St. Mary's County. And that has been through the concerted efforts of many, many partners over many years to really build up options for our community members who are struggling with mental health concerns or substance use, so that we don't create it as, or we don't allow it to perpetuate as a problem in the justice system. We are actually treating the health concerns that are involved here. And so this mapping process was incredibly helpful for the range of partners in our community, because it allows everybody to really understand why we have all these different programs and services and how they can be leveraged at different points along this sequential intercept framework. It also helps us to identify areas where we can make our efforts stronger and where there may be opportunity for new intervention or strengthen existing intervention so that we contribute to the bigger mission, which is to reduce recidivism, to improve health outcomes, and decrease strain on our justice system.
Thank you for this chart. This is very good information to have.
Great,
Appreciate
thank you.
this.
I have a larger handout. I can pass out a little bit. Thank you. And just to switch gears a bit to environmental health, we've, of course, this is a Board of Health meeting after the completion of a fiscal year, so we like to give some highlights as to all the work of our environmental health team. And really, can't say enough about our environmental health team. They really are very present in the community and are working very hard to address a variety of community concerns and needs. Some of the, one of the highlights that I've been mentioning over a few meetings now is the effort to digitize our property records. Digitizing our property records has been a part of a larger, we're pretty much complete with that project, let me say that first, where we have scanned in all the many years, decades really, of records, and we're finalizing the process right now of marking those charts so that they're searchable in databases a little easier. But this has been a longstanding effort, and I just want to recognize the leadership of Heather Moritz, our environmental health director, who is here today, and her whole team who's been involved in getting this project completed.
So will those records be accessible through the county's GIS?
Yes, that
That's
was
wonderful.
the idea, to have land records accessible through the county GIS system, septic system records right now. If you, on this slide here, this part of digitizing our environmental health records is part of a larger strategy of data modernization for the health department overall. And over the past couple years, we've made significant steps to assess our technology capabilities and data infrastructure while increasing our staff competencies in this arena as well. And I'd like to recognize two of our health department leaders, Michelle Pottinger and Lisa Nelson, who just completed a one-year public health informatics certificate program through Bowie State University. This is a graduate certificate. It was a special initiative made available by the State Department of Health for public health professionals who were willing to put in the extra time. And we're just really proud that they're now graduating with that graduate certificate, and will now be bringing that skill set back to our agency and leading some of our efforts around data modernization and data governance. We also just recently were notified that we were selected through a national, very competitive process to receive support from the CDC Foundation, which is a nonprofit organization, for accelerating data modernization in the public health space. So they will be in kind providing us with 2 full-time team members for 18 months, a data modernization project manager and data engineer, which will really help us build upon what we've learned in our assessments over the past couple of years and actually begin implementing and improving our technology and data infrastructure. Our Healthy St. Mary's Partnership, which is our local health improvement coalition, had a great annual meeting in September. As previously announced, we also set up a texting service to support food security and healthy eating in our community. There's lots of planning going around right now, as I'll in the next couple slides talk about planning in particular. Our local health improvement coalition is beginning its community health assessment process. I know Jenna is very familiar with this, having been the one to kick off our Healthy St. Mary's Partnership many years ago. And this community health assessment is a process that we go through every 6 years alongside our community partners, including the hospital, to look at all the quantitative data, to gather qualitative data, to gather input from all of our residents and community partners about what the health priorities are for this county, and to set strategies and objectives on how we as a community can improve our health outcomes. And so this process is currently in the assessment phase of gathering a survey from our organizational partners. We expect the assessment process to take the majority of 2026, and then we'll start moving into the planning part towards the end there.
So kind of related to that.
Sure.
In a roundabout way. One of the concerns that I think we hear a lot, or at least I hear a lot, is about the capacity at our hospital, at MedStar St. Mary's. Do you have any thoughts about how MedStar St. Mary's is able to handle our growing population?
Yeah, that's a great question, and I would defer the specifics, of course, to hospital leadership. I know hospitals use this community health assessment process to identify what the kind of emerging needs are in the community so that they can build their own plans in response to those needs and staff up as they need to. It's always difficult in rural communities to recruit healthcare providers, and I'll talk a bit about that more in a future slide here. But I know the hospital being part of the MedStar system is, of course, looking at it at a system level,
Right.
not just a county level, on how they can mobilize resources to our county to address the needs of our growing population and so forth. But it's really important for our community members to have a voice. And if they have concerns with access or wait times or whatever that might be, use this process to bring that up, because this is the information that the hospital then translates to their planning process as well, in addition to our community health improvement planning process.
Good, thank you.
Thank you. And there'll be plenty of opportunity for that. We'll have a public survey and we'll announce it broadly as well. And there'll be other opportunities like town hall meetings and so forth for the community to come and express their voice. Thank you for asking that. Alongside our community health assessment planning, our health department is also steering our own agency strategic planning. This is for the next fiscal years, and its focus is more on how the health department could better fulfill our public health responsibilities and functions. We're working with Maryland nonprofits to facilitate this process, and it will involve gathering input from you as members of our Board of Health, and our team members, our community partners, our community members, all will have an opportunity to provide input in our agency strategic planning. And I hope to, at the next Board of Health meeting, give you an overview of what that plan is based on all the feedback we've gathered. In this agency strategic planning process, we'll also be looking very closely at the findings and recommendations noted from the Maryland Commission on Public Health. The Maryland Commission was established as a statewide body by the legislature to assess Maryland's public health capabilities and make recommendations for improvement. And so after an intensive 2-year process, a very intensive 2-year process, the commission published 62 recommendations that are organized into these 5 themes here. The recommendations are expected to inform future legislative and administrative decision-making, of course, to the benefit of all Marylanders. So as we take part in our own agency strategic planning, we're trying to align our efforts with recommendations from this statewide assessment. Just some national context and how those impact us locally. As you may know, there are a variety of current or evolving changes in the national public health landscape. So I'd like to talk about the local impact of this context. Our local approach remains evidence-based, practical, and focuses on protecting access to health care while keeping our families and our healthcare providers well supported. I'll touch upon these topics here relevant to access to care. I'll also highlight what's ahead with the Rural Health Transformation Program. And I did want to mention related to our federal technical assistance and grant support. Our local health department for decades has received significant funding from the federal government and significant technical assistance from staff at the federal government through many of these grant mechanisms. So some of the support has changed recently because of staffing changes at the federal departments and also because of efforts to end funds, certain grants that come to local communities. For example, we will no longer be receiving federal funding to treat tuberculosis for uninsured or underinsured individuals. Tuberculosis, for decades, health departments have been addressing tuberculosis, which is a very contagious lung disease. It is one that, as I mentioned, for decades we've been working to control and keep from spreading in our communities. That is an example of how this change is impacting us locally. First, in the access to healthcare category of changes, there are anticipated changes to Medicaid eligibility in the state and therefore in our county. 1 in 5 county residents rely upon Medicaid for health coverage. This data was from a recent assessment by Hilltop Institute. Coverage losses are expected under these federal changes to Medicaid, and we do think that these families who will be affected locally may experience more gaps in their care and some financial hardship associated with that. We also at the health department, given our role in getting individuals enrolled in Medicaid and recertified in Medicaid, because the eligibility redeterminations will now be every 6 months instead of every year, that will translate to an increased burden of work on the small team that we have handling this at the health department. Another access to care anticipated change is potentially changes to subsidies for insurance purchased on the Maryland Health Benefits Exchange or Maryland Health Connection. So these are the number of St. Mary's County residents who are enrolled in health insurance or dental insurance through the exchange. At this point, we're waiting to see if there will be continuation of the subsidies for these health insurance policies purchased on exchanges. And if there are changes to those subsidies or reduction in those subsidies, it may lead to coverage losses and more uninsured individuals in our county.
So this is Obamacare.
These are for the ones set up through the Health Benefits Exchange, yes, made through the Affordable Care Act, through Obamacare. Rising uninsured rates, when you brought up the hospital capacity to respond, this is definitely relevant because we know that when there are more uninsured individuals in a community, that puts greater strain on healthcare delivery systems within that community, financially, as well as, people tend to show up with more complex needs later on if they don't have access to care. Additionally, I want to acknowledge that there have been some national changes in vaccine guidance and messaging, and some recent federal recommendations, such as changes around the COVID vaccine and the hepatitis B birth dose, now are different from recommendations that major medical societies have. In Maryland, the state health department has reaffirmed its commitment to rigorous science, and locally we'll be aligning with the consensus recommendations of the American Academy of Family Physicians, the American Academy of Pediatrics, and the American College of Obstetricians and Gynecologists. And our focus, again, will be to ensure that families have clear, consistent, and evidence-based information, and to secure their access to care for their families. Vaccines continue to be available in our community. For those children eligible for the Vaccines for Children's program, they can continue to receive childhood vaccines through our main office and at primary care offices throughout the community. Also, Maryland is launching a new vaccine program that is intended to ensure that uninsured adults have access to vaccines as well. So here locally, we're trying to bring the resources of that program to St. Mary's County. And so that will allow us to be able to offer free COVID and influenza vaccine for uninsured adults starting in January.
And that'll be state funded?
That is provided through the state, correct. That's all provided through the state.
Have you seen a decrease in, because I know there's a lot of news about, vaccine choice and people not vaccinating. Have you seen a decrease in locally of vaccinations? Or
yeah,
is it
anecdotally, we've been hearing that from some of our healthcare providers. We don't yet have, reliable data at the population level or at the county level to be able to say that there's definitely been a decrease in vaccine options, but it is something we're tracking and following. It certainly varies by the type of vaccine. I think nationally there's concerns that flu vaccine there's been decreased uptake of flu vaccine. Nationally, it's being reported that there's decreased uptake of some of our childhood vaccines, especially the measles vaccine. And so those are, of course, things that are very concerning to us because public health doesn't necessarily have county borders. And so what's happening nationally and at the state level and in our neighbor jurisdiction definitely affects our risk here. Fortunately, Maryland generally, when you look at it on a national basis, Maryland generally tends to have higher rates of protection from vaccine just because of our school-related policies around vaccination. But we definitely have pockets of individuals who are not vaccinated or travelers or those types of situations where we introduce illness into our population.
Take measles, for instance. I mean, what are the health risks if you don't get vaccinated? Because I remember when I was a kid, I had the measles, and a lot of my friends did, and it was considered a harmless childhood malady, and you got a few days off from school.
Yeah, and for many people it is. But there are definitely situations, and the concern that led to measles vaccination, of course, is the risks, especially in children. There's a variety of health concerns that can emerge from measles infection, including childhood deaths. The Western Texas outbreak that we saw recently in the last year and beginning of this year involved 3 childhood deaths and multiple hospitalizations. I spoke with a couple of the local health officers directly involved in that outbreak response, and they relayed to me some of the challenges and concerns they were having with child hospitalizations and complications. We've seen complications later in life related to childhood measles as well, brain impacts and so forth. And certainly I can come back and talk more about this because has been something I brought up a little bit in prior Board of Health meetings, but certainly is something that we're more concerned about nationally as getting measles emerging more and more across states.
Thank you.
As you know, for some time, commissioners, our whole county was designated a mental health professional shortage area. This is a federal designation. It's based on the ratio of population to healthcare providers in that category. We also had a primary care HIPSA for the southern part of our county. We are now under consideration for a primary care HIPSA for the whole county. And a high needs mental health HIPSA for the whole county. This has a lot to do with not just the growing population, but we've also had experienced, they relook at these metrics every handful of years. And so in the past handful of years, we've had retirements within our healthcare workforce. We've had people departing the county in our healthcare workforce. And that also affects the ratio of those healthcare providers to our population, in addition to the growth in our population. The high needs mental health comes because they specifically look at the availability of mental health care providers for children and for seniors. And so because we have shortages across the whole range, but we specifically also have shortages of mental health care providers that treat children and that treat seniors. And so that's why we're getting the high needs, or we're under consideration, I should say, for the high needs mental health HIPSA for our
I have a
county.
question for you on that. Is that the high needs for primary medical care, is that actually physical people, doctors in the county? Because just recently, I went to I had an eye doctor appointment, and it was all done by video. So,
Yeah, that's a great question. Telehealth definitely changes things. These designations come from the geographic area. So if we're looking at a geographic designation of county, then they'll look at who within the county borders are serving as primary care physicians
actually,
for our
where
population.
you can go and talk to a doctor person to person. Okay.
Exactly. And for mental health, they'll look at who within the borders of the county, since that's the designation, are mental health providers, and what patient populations will they see? Do they see children? All of that gets noted in order to, and has led us to this high needs designation.
Excuse me, Dr. Brewster, with the primary care designation for doctors, that's basically just general practice, or is there?
So primary care involves family medicine, internal medicine, pediatrics. It, in some cases, can involve OB-GYN if they're practicing as primary care physicians. So that's what they look at, those individuals. And they also look at primary care nurse practitioners as well, who are functioning in that geographic area.
So as far as on the MD side of the house, are there more medical doctors coming in as specialists as opposed to primary care, or is that something that's
We
taken into
do have
consideration?
shortages in specialty areas. These federal designations really only look at mental health, primary care. There's also a dental one. There's not a specialty designation that the federal government gives for counties, because they see the foundation of healthcare as being primary care and behavioral health.
Thank you.
So this brings us to that topic of the Rural Health Transformation Program, which is a new federal initiative where funding will go to all states, or is expected to go to all states to support a variety of initiatives to support rural health. We have 18 jurisdictions in Maryland that the state has designated as rural. We're one of those. We held listening sessions earlier in the fall to gather some ideas. I talked with our partners to gather some ideas that we submitted to the state for good use of this funding, and that reflects the needs of our county. The state then considered all of the input they received across the state and put together an application that they submitted to the federal government. They are still waiting on the decisions as to how much funding they will get and what specific initiatives they'll be able to roll out. But these are what have been proposed. The three big categories are going to be about the rural health workforce, and definitely speaks to some of the questions that have come up already and some of the discussion that we've had, to promote sustainable access and innovative care. and to focus on healthy eating within rural Maryland. And so some of these items here are what have been proposed. I'll come back when we have more information about what specifically will affect our region in Southern Maryland or St. Mary's County in particular. We are expecting to have more options in our community around nutrition education, and we are expecting to have some initiatives related to a pipeline for healthcare workforce and strengthening our healthcare workforce initiatives that we have here locally. Thank you. Also, Commissioners, I'd like to wrap up with just some highlights of recent outreach from our community, to our community by our health department team. Our behavioral health team in particular has participated in a variety of community events related to mental health and prevention and recovery from substance use. So that includes Red Ribbon Week through the school system, the 4th annual Walk for Recovery, Recovery Fest, and the Maryland Out of the Darkness Walk. We've also had some specific community outreach related to youth and families. I'm highlighting a few items here because they seem to resonate very well with our community. Dozens of families received support through the drive-through community baby shower held in October, and the next one is tentatively scheduled for May 2nd. That's the larger one. The spring one is our larger one. We've also been providing vision and hearing screenings to our non-public schools. The public schools have their own process where they handle that. And we've also this year have been doing infant hearing screenings as well, because sometimes infants might fall through the cracks of getting their hearing screening, and this can set them up, unfortunately, for long-term problems later in life. Some additional ones that are noted here for community members who may be watching. Parenting workshops have been going well. We have the last 2 sessions for the currently scheduled series coming up. Starting this week is Parenting in a Digital World, something I know many of us as parents are concerned about.
Very nice.
Our Healthy Heart Ambassador Program, which is designed to help community members better manage their own heart and health, cardiovascular health, and that includes managing their blood pressure. Our nicotine cessation classes. January seems to be a popular time when people refocus on their goals to quit smoking and quit nicotine or quit vaping. And our nicotine cessation classes are scheduled and open, and we're eager to work with residents who are ready to quit.
Can I ask you a question about vaping?
Sure.
I know when the craze first started, everybody was like, there's really no medical evidence. Are you seeing now that it's been around for a while, is it as bad as smoking?
So vaping,
what are the risks?
Yeah, that's a great question. Vaping is used by some people to help step away from the use of cigarettes. The challenge with vaping is the amount of the drug that's in the vaping tool is not standardized, right? And so when we're dealing with an addictive habit or addiction, a chemical addiction like you have with nicotine, it's really important to have a regular amount and a decreasing amount of that drug over time, or to just stop, right? So with vaping, it's difficult because you can't control how much nicotine you're actually getting through that process. And so that's why we recommend for people who are interested in actually quitting their nicotine addiction or substance use, that they instead use some other techniques where it's actually, the amount is actually regulated. That's in like a patch or a gum strategy, or actually there's medication as well that can help with nicotine cessation. We are still waiting on more longer-term studies around the effectiveness of vaping for helping people deal with nicotine cessation. We have a lot of concerns with vaping as well, including some of the chemicals that are in. It's not just water evaporating. I mean, there's actual chemicals in the vaping tools. Especially, we're seeing a lot of youth and young adults utilize vaping of other substances as well. And there's mixing of substances in the vape tools. There's dangers associated with the vape mechanics itself. So there's a lot of concerns with vaping as well. But there are available, reliable, and healthy ways to quit tobacco use, and that's part of what our nicotine cessation classes go through. Food safety classes, we've offered this to the community year-round. We'll soon be announcing the 2026 food safety class schedule. I know we've had a robust use of these classes over the years.
Dr. Brewster, on the food safety classes, when are changes to requirements for food trucks addressed during these classes also?
I don't believe we go into the regulatory aspect of food trucks. It's more about how to handle food safely. So a lot of individuals in homes or workers in restaurants, for example, take this class and learn about that. We do go over some of the regulations. I'm not sure to what detail we talk about food trucks
Okay, 'cause,
specifically.
I'm just bringing that up because during the Blessing of the Fleet, we actually was able to go out to help with the Optimist Club, 7th District Optimist.
Wonderful.
And given my dual roles in my life now, it's a lot less time I get a chance to do that. And I noticed a couple things different with our big cook trailer, and there was, a no smoking sign, which, should be anywhere because smoking is disgusting. And then there was also the need for special wheel chocks for the wheel chocks that we were using weren't up to par for the health department, and we had to buy auxiliary fire extinguishers, even though there's already a halon fire suppression system built into that trailer. And I think they were having, I don't know if it was an actual, you aren't allowed to do anything until you address these issues, but it was sort of a surprise sprung on them. And I was wondering if there was, when these new rules or regulations, one, who comes up with them, and two, how are the individual vendors notified? Because we all have our licenses
Sure.
to you guys, and it wouldn't be anything to shoot out an email to everybody, go, hey, by the way.
Right, absolutely. Thank you for bringing that up, and I can certainly talk about it with our food safety team and our environmental health team. I know Heather's here in the audience. Food trucks are a little bit more challenging just because sometimes they're registered in multiple jurisdictions, so they may be actually originating from another jurisdiction. But certainly, when there are regulatory updates, we can look at finding mechanisms to share that information with all of our registered food service
I
providers.
don't want someone to get shut down on the day of an event and
Right.
lose possible revenue.
Yeah,
For anybody. not
A
just
lot
the
of
club.
times when they are when they're applying for their license or they're getting registered in the first place as a food service facility, our food safety program specialists will work with them and work through the regulations as they're setting up their initial operations. But I'm not sure what the ongoing communication may be when there's a change to the regulation in terms of getting
Thank
it
you.
out.
I appreciate that.
Yeah, thank you. Great. And then, of course, we do offer CPR first aid training for the community, and here are some dates set up already for the spring and the rest of the winter. We would invite, we love the work of our team, and our school-based health centers, our health hub have been an initiative that this commissioner body has supported very much over the years. We certainly invite anybody of our community members, healthcare providers in the community who want to come out and check it out. We have an open house scheduled for February 17th. Thank you. Thank you, commissioners.
Good.
So one other question, Dr. Brewster. I feel like no data behind this, but last year it felt like it was a really bad flu season, and this year it doesn't feel like it's as bad. Do
It's
you have-
rising.
It's rising now?
Actually, we're putting out this week a communication to our healthcare providers, highlighting some of the respiratory disease rates. And we've definitely seen a significant jump from October to November. We're really at the beginning of flu season, and so we're expecting it to be a significant flu season, especially if what we're hearing anecdotally, that there's been a decreased uptake of flu vaccine. If that holds true, we're expecting it to be a significant flu season. But we'll know better how the whole season looks probably closer to March.
So it's not too late if people still want to get a flu
Abs-
vaccine?
Go ahead and get your flu vaccine. Yes,
Never
please
too
do.
late. Okay.
Most pharmacies carry it. Most healthcare providers carry it. The health department carries it for children eligible for VFC, and then we also will start carrying it in January for adults who are uninsured.
And anybody can go into the health hub and get a flu vaccine.
So we don't have the flu vaccine at the health hub at this moment unless there's an event that we organize there for flu vaccine distribution. We've held clinics throughout the community. We've partnered with the hospital to hold clinics where children and adults can get their flu vaccine. But when the Maryland vaccine program starts and we receive vaccine shipment in January, we'll start offering it to uninsured adults in January. But really, anybody, if you have insurance, a lot of the pharmacies have it, and the healthcare providers do as well. We encourage our community to use that. Thank you.
This doesn't directly relate to you, but I got a disturbing letter yesterday.
I'm sorry?
I got a disturbing letter yesterday.
Okay. I'm
Your
sorry.
sister is retiring.
Ah, yeah.
Is that true? Retiring?
Yes. My sister, Dr. Lee, she's retiring in February. She's
Adding to the
dedicated
shortage.
many
And she's
years
been
of her.
my primary care for almost 20 years.
She's a
And,
wonderful family doctor. She's the one who inspired me to go into medicine in the first place. And she has had many years of service to
Is she
St.
going
Mary's
somewhere
County.
else, or is she fully retired?
No, she's retired.
Retired,
Yep,
okay,
yep.
wow.
She
I
hopes to
reckon that's
take on
good, but
other
it's bad for me
endeavors.
because she's been
Yeah.
very good for me for almost
She
20
will
years.
be a grandmother soon in the spring. So
Is that
I
right?
think, yes.
Well, good. Thank you very much.
Thank you.
Anything else,
Appreciate your time.
commissioners?
Nope.
Okay.
Thank you, Commissioner.
Thank you very much, ma'am, for your time.
All right, I move to adjourn as the St. Mary's County Board of Health and reconvene as the Commissioners of St. Mary's County.
Second.
First and second, all in favor? Aye. So moved.
Thank you.
Thank you.
Next, we go right into county commissioner time.
Thank you, Commissioner.
County
County
Administrator.
Oh, I'm
Administrator
sorry, county
time.
administrator. I'm still on my time, yeah. We got county administrator.
Put me in my place, please. Thank you, Commissioner President Guy. As always, we'll start with draft agendas for January 6th and January 13th of 2026. There will be no meetings on December 23rd and December 30th. On January 6th, you'll start at your normal time and place, followed by one proclamation for National Mentoring Month, followed by the Department of Public Works and Transportation decision on the Preston Court intersection, followed by County Administrator time, Commissioner's time, adjourn, and at 1:30, there'll be a memorial ceremony for Randall Hill. On Tuesday, January 13th, you'll start at your normal time and place. You'll have County Administrator time, Commissioner's time, adjourn, and that evening at 6:30 will be the first Commissioner Public Forum of the year. And today, the first thing was from the Circuit Court of St. Mary's County Cooperative Reimbursement Child Support Agreement. It was continued once before. They said that Miss Magistrate Armitage, I guess they have really loaded her docket, and she is unable to be here again. It's a $16,000 grant. It's basically $10,000 from the federal government, $6,000 match from St. Mary's County. I think it goes to pay salaries of two of the individuals that work there. I don't know how the commissioners feel about it, if you'd just like to take care of it, or if
I
you
mean,
want
this
her
is
to
a
come.
recurring every year.
Yes,
I'm okay to move forward with this.
I'm fine with it, too.
All right, I move to approve the cooperative reimbursement agreement in the amount of $17,007 for FY 2026, project number US 2627, from the State of Maryland Department of Human Services Child Support Division on behalf of the St. Mary's County Circuit Court, and authorize the Commissioner President to execute the related documents.
Second.
Discussion. Ask the magistrate to make time for the commissioners. We usually have the judge here. We usually have, yeah, tell him.
I certainly will.
Yeah,
Yeah,
I mean,
that
twice
was-
now, that's too much.
Yes, it was late notice yesterday of about 7:20 last night, or else I would have reached out, but I will reach out.
Got a first and second, all in favor? Aye. Any opposed? Ayes have it.
Thank you. And the next item is from the Sheriff's Office for position conversion and reorganization with corrections and law enforcement. I see the sheriff making his way. I see the warden and Captain Smith, right? Welcome, welcome.
Morning.
Good morning. This is quite the moving chessboard here, isn't it?
It is. I'm worried about the timing, actually. But we can go there. Go ahead and put your presentation on.
Well, let's start things off with a happy birthday to Commissioner Alderson.
Thank you.
So the decision for the conversion and this reorg was not done lightly, and it was done with a lot of research. But it has become necessary to request this to meet the mandates, constitutional and legislative, and to meet the mission of the Office of the Sheriff. So I have a very qualified commander that's going to get into the details of what we are requesting and why. And I will turn it over to Captain Sarah Smith.
Good morning.
Morning, ma'am.
So what we're presenting today, it's not an expansion of our current staffing. It's a necessary realignment of our vacant positions to match our operational demands that are being placed on our agency right now. Over the past several years, we've seen dramatic increases in our Public Information Act request, our court-ordered expungements, our evidence and digital media needs, and the need for stable community-based correctional services. This is not a temporary surge. This is a permanent and ongoing workload growth that we're facing. The structure we have today no longer aligns with the work that we're legally required to perform. This reorganization uses our existing vacant positions to ensure compliance and support our operations. Just a general overview of the conversions that we're asking for today. In the Corrections Division, we're asking to convert 4 currently vacant correctional officer positions and 3 current TPT positions into 2 offender reentry case managers, 1 mental health offender case manager, and 1 pretrial case coordinator.
Real quick, what's TPT? Sorry.
Temporary
We're
part-time.
going from a temporary part-time and some grant-funded positions to FTE, which are our full-time positions. It just goes to show that these roles are essential for our day reporting, pretrial supervision, and offender reentry programs, all which require consistent staff, not temporary or grant-funded positions. Within the Administrative Division, we're requesting the conversion of 1 currently vacant sergeant rank into a lieutenant rank, and the conversion of 3 vacant station clerk positions and 1 TPT property specialist into an administrative coordinator, a senior classification specialist, and a full-time property specialist. These conversions will align our administrative support structure with the size and the complexity of the agency that we've become. These conversions rely on our existing vacancies, and that's at the request of this board. We went back March of this year. You guys kind of let us know that before we ask for any more full-time positions to be added, let's look at where we can convert the vacancies that we're really struggling to fill. So we went back and we did a study of that, and that's why we're bringing this to you guys now after a look at all of those things that we could do based off your request in March during this budget cycle. The net impact of all of these position conversions is $8,741. Those are primarily IT costs, and we're willing to absorb that into our FY26 budget. And moving forward, we expect that to be a savings when we're looking at training needs, uniform needs, things like that, that will no longer be considered. So we won't be looking at that additional cost in future budget years. So in conclusion, the structure no longer matches the workload, and delaying this reorganization would allow current risks to compound with these programs. So we respectfully request your approval of these conversions.
I mean, this seems easy enough to me. It's your office to run, and we give you the budget to run it with, but we're not going to dictate to you how it has to be spent. And if this is the way you think it should be done, then that makes sense to me. None of us are law enforcement professionals up here.
It's the real challenge is the legislative part of it. That's the things that are mandated by a particular date or time, expungements and MPIAs. We are just barely above water in trying to maintain that. So when you hear that from staff, you put it to command, you make the difficult decisions because we covet those badges. You know that. But I had to make that decision to be able to meet the mission of the Office of the Sheriff and to keep us within compliance of the law.
Understand?
So Captain Smith, a quick question for you regarding the admin lieutenant position. So I understand how much of a workload that is going to take off of you. And going forward with the, especially with the property specialist and all those things. So just so everybody else knows, you basically handle all that stuff right now for the entire agency, correct?
Yes, sir. Currently, the Administrative Division has 35 positions, and that would be growing with these conversions. There's also a rank structure that we support where several of the parts of the Administrative Division touch our rank and file. Our Records Division, we're regularly in contact with those patrol lieutenants to work through reporting issues. Our Property Division, we're regularly in contact with those patrol lieutenants to work through property coming in and out to the courts. And adding that administrative lieutenant adds that administrative support to the parts of the division that touch the sworn side. That adds the appropriate level of support from captain to lieutenant to sergeant to the rank and file. And it allows me honestly to focus on our strategic needs, our personnel, our HR, our budget needs, things like that.
How are you delegating all of that stuff now? I mean, because that sounds like a huge workload.
It is. I have some very competent civilian supervisors in every unit, and I could not do my job every day without them, without my managers that we have. But as we grow the agency and the professional staff that are needed to support our sworn operations, we also grow our need for supervision there. So while we're doing it now, and I could not do it without my managers in each department, it is necessary to add another layer of support there.
Commissioner, just to add that, this is the only division of the Office of the Sheriff that does not have that mid-level supervisor support.
Any questions, Commissioners?
I had a few. So, Captain Smith, thank you for looking at this idea of taking existing vacancies and moving into positions that you need. And this idea of the structure no longer aligns with your mission, I get it. So tell me, how many vacancies do you currently have?
For which role, sir?
Sworn and corrections.
So for our sworn positions right now, I believe off the top of my head, we have 8 vacancies. However, we have no what are called conditional job offers on the sworn side.
You have 8 vacancies.
Correct.
What
However, that means there are 8 people in the process for the positions. So from start to finish, you get a conditional job offer. Once you come in, you do your application, you do your testing process, you go through your interview, and then before we can administer a polygraph exam to someone and put them into the background process, we have to issue them a conditional job offer before we start kind of going through their background to see if they're the right person for the position. And we do this for sworn and for corrections. So as soon as we issue that conditional job offer, it takes one of my vacancies off the table until I can decide whether or not this person's background meets the criteria set forth by our expectations, Maryland Police Training Commission, and all of those standards out there for them to actually go into the academy and become a correctional or a police officer. So on the sworn side now, we do not have any conditional job offers available. We have several people in background. It's the first time in a long time we've been able to say that, and we're really excited. On the correction side, we currently have 20 vacancies. However, many of those are in the conditional job offer phase also. I only have 7 available vacancies on the correction side.
Okay, thank you. Well, my question revolves around, been a commissioner now 11 years, and every year the Sheriff's Department has returned funding that we've allocated to the Sheriff's Department. This past year in our audit, we found out that the sheriff returned $2,100,000 and some thousand from, I think I would call the sworn side, and the correction side was about $762,000. I follow these numbers, and the total was about $3.5 million. So what I'm concerned about is when you're moving people from a vacancy that it sounds like you don't have to work this other position, does this mean you're going to come forth needing new people when the budget comes up in a couple months? Are you going to be requesting more officers?
Commissioner, based on what is being requested today, there's no plan to ask for any new positions. That's what gave birth to the idea to come before you today. There
Okay.
will be, however, there's a caveat, and it's to follow. When you open an additional courthouse, you required more staff to do that. So that's what's to follow. But if that is approved, I do not anticipate coming before this board and asking for new positions unless the legislature does something that requires us to have an unfunded mandate, which they have done in the past, and I fully expect them to do possibly
Well, what I'm
this
happy
year.
to hear, I'm sorry to cut you off, sir. What I'm happy to hear is that you're able to fill your vacancies. I mean, that's good. I mean, corrections is a little bit concerning with 20, but I would say in the past, we've always had these vacancies consistently coming back before us. And what I will continue to say is until you fill your vacancies, it's hard for this commissioner to vote for more people. So with that said, hopefully you're telling me you're not going to be asking for new positions, and I appreciate that. If you need them, obviously we got to do what we have to do. So I also have some questions on the court side, but that's for a later time. But last thing is this. The people that you're taking and putting in these positions, aren't they already doing a job for you somewhere now? Or are these new people that you're hiring?
So it depends on the position, to be honest. So when we're looking at a conversion of a rank, that would be a promotion of someone in-house, a lieutenant. So that would be a promotion based off of a current list that we have, an eligibility list, should a position become available and necessary and the sheriff choose to promote. On the correction side, we currently have employees in grant-funded positions and in TPT positions, which are not stable positions, which is why we're converting them. And there's one grant for day reporting right now that we were supposed to receive September 30th. We have not received the grant. We have not received any extension on funding on that, and we're paying that currently out of vacancy savings. So what this will provide is a secure job for these employees to apply for, that if this is not awarded, then these positions may no longer be available for them.
And that's always been the issue with grant funding.
Absolutely.
Is that if you don't get it, because once you get used to the person doing the job, you get used to having that service. And once the money goes away, then usually it's up to the county or whoever to provide the money to backstop it. Well, I'll be interested to hear your budget presentation come up in a few months. And I'm happy to hear that by doing this reallocation will not require you to backfill those positions with additional people when the budget comes along. Okay, with that said, I'll move to approve the sheriff position conversion and reorganization as requested to convert 7 vacant full-time equivalent FTEs positions to create the following 7 FTE positions: 3 offender reentry case managers, 1 pretrial case coordinator, 1 coordinator 3, 1 senior classification specialist, 1 property specialist, and 1 vacant sergeant rank and 1 lieutenant rank. I further move to approve the related budget amendment to realign funds from the Sheriff's Office budget to the Department of Information Technology budget and authorize the Commissioner President to sign the related documents.
Second.
I have a first and a second. All in favor? Aye. Any opposed? Ayes have it. Thank you all very much.
Thank you all very much, and a very joyous holiday season to each of you.
Thank you.
You too, Warden.
Thank you. And next up, again, is the Sheriff's Office requesting 2 additional full-time contract deputy positions for court security, and the warden is being replaced by Captain Russell. Welcome.
Good morning.
Morning.
So once again, Commissioners, as I said, we got word from the administrative judge's office that they anticipate the new courtroom opening the very first part of the next year. So that was, I congratulate building services and everybody that was involved in that. Very quick build out because it seems like just the other day that we were approving the construction. That will definitely affect manpower at the courthouse. We have an acceptable level of security. It is lauded when we are, when they come and do inspections and audits of our courthouse. We are seen as doing a great job. I do not want to sacrifice that. An additional courtroom is additional work. Each one of them will have a deputy sheriff in it. Without getting into specifics about where the posts are, it does require us to have redundancy so that people can enjoy their leave. People do get sick. People have children and other things. And then people sometimes need to have a bathroom break. We have experienced some times where literally people cannot leave the courtroom because we don't have any staff. And I believe the captain and his lieutenant have actually gone over there and worked in the courtroom themselves because we were short. So this additional courtroom requires the 2 contract deputies.
And if I could just add, also, the courtroom is supposed to be up and running any day. We actually expected it to be ready this week. So that's, we already have visiting and retired judges coming in. Recently, they were sharing a courtroom to fulfill the dockets that they had. So we anticipate that being used. And with the magistrate, being busy as well, that's an additional, 5th room that needs to be covered as well.
Hold on. So, in your flow chart here that you proposed, you have 2 vacancies already. So you're requiring those 2 vacancies that need to be filled and you want 2 more on top of that.
Right. The two,
So
I
it'd be
believe
4
two are
positions.
currently in background phase. We have a lot of interest, and we've been very successful recruiting people from other jurisdictions to come down here because we've made it a very attractive contract for
So you're
people.
saying you have 2 people that you're about to bring on?
Yeah, I
We
can
have
speak
their
to that.
interviews to the end of this week for those 2 positions.
We have 2 applications received and scheduled from longtime police officers from another jurisdiction who have retired and are looking at that position. It's listed as a vacancy. No CJO has been issued, which is where we take the vacancy off the table. But we do have 2 currently ready to be interviewed and start the process for that position to fill the vacancies in the void that we need filled currently before
Okay, well,
the
tell me,
addition.
does that require the same extensive checkout or whatever you do for new officers coming on?
Absolutely, sir.
All right, so these people will have to go through that process, which will take whatever length of time that takes. How long before you think these people, if you fill these positions, how long before they're filled?
So depending on where the officer comes from depends on their training necessary. If they're a Maryland certified police officer already, it's a shorter training program for them. If they're coming from another jurisdiction, like we seem to see sometimes from Washington DC or Virginia, then they have about an additional month of training that's required. So between a background and all of that, we look at a 3 to 6 month window.
I was in contact with the new Judge Hill, and he indicated that he's been working since September 1st. Now, I'm not sure what he's been doing. Maybe he's, look, that's his story. I'm fine with it. So the key is this courthouse up, this courtroom up and running now?
The 5th?
Whichever one,
No.
Judge Hill?
We anticipate it's either going to be at the end of this month or the first of the year. It's what the administrative judge's office told us this
okay,
week.
so if you're I'm sorry to cut you off, sir. If you're going to be a few months behind getting people ready, how are you going to handle it?
We get it done. We pull people from the road. We pull people from other places. We have pulled them from the schools. We have to get it done. It's a constitutional mandate,
Okay.
and I'm not going to sacrifice the security of the courthouse.
And honestly, I totally agree, because you've had some incidents over there with unruly people in your courtrooms that definitely need to be controlled.
I move to approve the sheriff's request to add 2 new full-time contract deputies for court security to be effective immediately in support of the additional courtroom being added.
Second discussion, real quick. Sheriff, I'm supportive of this also. The only thing I would say is it sets a dangerous precedent that we've done in the past where we're budgeting for our next fiscal year budget already. So I believe you have the money in your budget to cover this for the remainder of this fiscal year, but then these will automatically get added into next fiscal year's budget. It's something we have to remember and take into account when we're building next year's budget. We did it previously with the state's attorney, and it's not the usual course of action, but definitely understand the need, so I'll support it.
Yeah, I wish I could control growth and requests that other people make or laws that are passed that directly impact this office and this community. But we have to be, we're chameleons, we have to be flexible, and
And
we'll
there
get
is
the
that
job.
constitutional mandate that we have to.
Yeah, we understand
fulfill
that.
also. I
We
mean,
understand that, yeah. Okay, anything else? We have a first and second, all in favor? Aye. Any opposed? Ayes have it.
Merry
Thank you.
Christmas.
Thank you,
Thank
Sheriff.
you.
Thank
Happy
you.
holidays.
Sheriff, before you leave, I want to pass along a little bit of attaboy and commendation to Captain Russell there. He was doing security at Sutton Post Farm on Saturday, had a little medical incident, and he was on scene to help render aid until rescue squad showed up. So thank you very much.
On his own time.
Yeah, yeah.
Thank you.
I got to lock the Grinch in a horse stall, so.
Thank you. Thank you, Captain Russell.
Thank you. Next up, from the Department of Recreation and Parks, the director is creeping up, for the Maryland Department of Natural Resources Green Space Equity Program Grant Application. Welcome.
Good morning. Merry Christmas, Commissioners. I have with me today Susie Glonner, who's the Executive Director of the St. Mary's County Arts Council and a partner in this grant application. So in 2023, in collaboration with the Arts Council, we adopted the Art Park Plan for the Lexington Manor Passive Park. This Maryland grant program, which is similar in many ways to the open space funding program that you hear about often, has a request for $210,000 with no cost or match. Luckily, art is one of the things that is eligible under this equity program. It would supply installations such as entrance arches throughout the park, improved ADA access, and a sensory path for the passive park. As well, in the application, we're asking for interactive play structures such as human-sized chessboards, artist-designed cornhole sets that would go both Nicollet and the passive park. I have Susie, if she'd like to share. She's the expert when it comes to art, so I definitely want to pass it to her.
Yeah, so when we got the grant to get the Arts Park plan, the intention was for a 3 to 5 year hope that we could fill the park with more art. I know you've all been there, it's quite a bit larger once you're there in person, so this, even though we have added quite a bit of art, it still feels kind of empty. So also the fact that, you know, public art can be quite costly. This is a really wonderful opportunity. My main funding source is the Maryland State Arts Council. The max that I can ask for every other year from them for a public art installation is only $30,000. Most of the time, sculptures can start at $100,000 and go even higher depending on what you're looking for. So you can imagine $30,000 doesn't go very far. So I'm very excited about this partnership that we could actually get some serious funding to cover a lot of those targets that we were hoping to fill in the park on a shorter term basis than we've had. So.
I think this is great. What's our level of confidence with this grant?
We've never applied for this grant before. It's very limited what parts of the state can to. They have a GIS map which identifies what they feel are overburdened communities or underserved. Nicollet is in both of those categories. The passive park is actually adjacent. The reason, I think, is because there's a heavy dosage of parks right there between, you know, the two parks that are adjacent. So we're hopeful, but there's no guarantee on this one.
Now, is there a county match involved?
The only match that we've offered to help with the scoring is our time implementing the grant. There's no cash involved.
Very good. I move to approve the FY27 Green Space Grant application through the Department of Natural Resources in the amount of $210,000 to support the Arts Park project at Nicollet and Lexington Manor passive parks, and authorize the Commissioner President to execute the related documents.
Second.
Discussion. Real quick, I was going through the cost list here on this grant, and I'm trying to figure out, what do you get for $8,000 worth of cornhole boards, for 4 boards? I mean, that is a hell of a
concrete
price.
structures that would also be artist inspired. So it's not your typical wooden cornhole kind of board. It'll be a set built in, and it's also ADA amenities leading kind of to those sites and things like that. But I agree. And the bigger part of this grant is the arches, which we've had some estimates based on other projects around the state, but those are expensive structures as well.
Are those similar to the arches that are down here in Leonardtown?
We're going to go a little more decorative and less.
Good.
Good.
Yes. So we've had a couple different possibilities floated, a mosaic style, or there is something that I may not be officially allowed to say yet, but there could be some repurposing of some historic wood from a well-known boat in the area that could be utilized to repurposed into some kind of structure. So I think that would be really cool if we
So
could
at
do
the
that.
end of the day, with the 210, if you don't expend all the money from the grant, does that money have to go back to DNR, or do you get to put that in other places in the passive park?
It has to be things that we've described in this grant, but we can, if we don't spend it, it has to go back. But generally, we spend all of the money that we get in our grants from DNR.
I understand that, because it was, at one of the public hearings, our most recent public hearing, we had some concerns brought up about disc golf, and I was wondering if there was some kind of improvements or something done to the disc golf course that if any money was left over from this, that we can roll over into that.
Yeah, we wouldn't be able to roll that over to disc golf, but I think the atmosphere as a whole would be helpful. And one of the things we're exploring is a kiosk that would be self-serve, so that if someone didn't have their own set of disc golf, they could rent cornhole bags, they could rent discs, they could rent other things like that. So a lot of people like to play disc golf but don't own a complete set, so that might be something that could fit under this grant, because it would be an amenity with the cornhole.
You know, the cornhole things, I'm not a champion at play. I do play. I got my own boards and everything, but they're got a certain, and I do remember playing on some concrete ones in the past somewhere else. but the surface got worn down. And whatever they had on it before was nice, smooth, but then all of a sudden now it's got a little chippity or whatever and worn down to. Cornhole bags don't slide very well on concrete. Unless it's got some kind of a smooth surface. I'd say very, make sure this provider puts the right surface on there or something that can be rejuvenated very easily.
We can
And don't
definitely.
use corn in the bags either because squirrels eat it out.
We can definitely.
The
hard way, right?
Yeah, the hard way. So
We can definitely put that in the call for art, that the surface needs to be
I
very
got some
polished.
nice sand ones down there, sort of
Yeah.
a coarser sand. They work pretty good. Same weight and everything. It's corn, but don't put corn in the bag. Everything else?
I'm good, yeah.
Okay. I have a first and second. All in favor? Aye. Any opposed? Ayes have it. Thank you all very much.
Thank you to the Arts Council, too. Great work.
Yeah, good work. Good work on that. Yeah.
And next up is also from Recreation and Parks regarding a proposed YMCA childcare facility MOU.
And this one goes into a little more detail, so feel free to ask questions. I'm going to invite Robbie Gill, Executive CEO of the Chesapeake of the YMCA of the Chesapeake. I'll get there. So we're here to discuss today the Child Care Center next door under construction. And I was last here on July 15th, where I asked the commissioners to seek a potential partner to help us operate the site. That was approved, and on August 18th and October 15th, the YMCA's leadership team and key staff toured the facility under construction with our team, explored a partnership, and agreed that there's something that's a really good thing for everyone involved, and wanted to move forward. So as part of that, we had more detailed discussions, and they had kind of one big request, which I think makes a lot of sense. Right now, the current plan under the current budget is to build out the facility for 70 youth, up to 70, and it leaves two rooms unfinished for future expansion. I don't think there'll ever be a time cheaper to finish that project. You'll also be doing that in the midst of an operating child care center, and it's $30,000 to finish those last two rooms as part of this project. So I'm proposing to you that we would take $30,000 of Recreation and Parks facility improvement funding to make up that gap. So not asking for any new money or anything like that. That pot of funds is how we do small projects throughout the county, so we'll defer some other things to the next fiscal year. So that is one of the big requests that's there. The lease, the agreement that's being worked on is pretty far along. The MOU today just kind of codifies that we want to take this next step farther, allows the Y to continue advanced planning. There's a lot of work that needs to come from the application side, from everything from state approval for a child care facility. Our goal is that, I think we're talking like April, that we would open for registration, have people walk through the building, get to know things like that, and then have the facility up and running in August, so we would be good to go for next school year. So the agreement is based off of a cost share of revenue that it would go up as enrollment in the facility goes. So there would be no payment to the Y or anything like that. It would actually be the opposite of that. And then there's incentives in the agreement that we're proposing that we plan to have before you on January 13th. We think we'll have it wrapped up at that point. That if hours are extended, the rate would go down, the percentage of gross receipts. And then also, there's an opportunity in there for a credit at the interest of Recreation and Parks, specifically the director, that up to 50% of that payment can be offset with uses of Y facilities. So that's everything from potentially basketball practices and games at the new Y. That could be camps coming to the pool. There's a wide array of things that could be as part of that credit to help offset those payments.
Wow.
I have one other thing, sorry about that. As part of the opening of the building, you guys have provided us one full-time FTE called a child care specialist. I had mentioned the last time that if we found a successful partner, we'd like to reallocate that to a position that we requested in last year's budget but was not able to be filled, to a human resources coordinator, which we have the full support of HR. That position would be dedicated to helping to onboard and train our 300 to 400 hourly employees, as well as dedicated to volunteer recruitment. I think there's a huge amount that we can expand in getting people to support our programs. And then my favorite part of that position is our recreational coordinators and folks in museums will have more time to do the work that they're kind of hired to instead of that onboarding and training and those type of things. So I'm asking for a reclass of that position along with this MOU that has no additional cost. The budget impact is their pay grade to pay grade are the same.
It is a little spur on the outside of what the focus of this was, but I'm okay with it.
So, just a couple of questions. This sounds like a good plan. This project has changed a lot from how it was originally brought forward and intended. I see the MOU does say the facility would be open to the general public, but county employees will have first preference for available spots and joining wait lists when needed. And so the original intent was as a recruitment and retention tool specifically for the sheriff's office, but for county employees too. So when it says county employees, that includes the sheriff's office?
We will provide to the Y a memo. It's county employees, but there's tiers of county employees. So my expectation has always been that emergency service and sheriff's office are kind of the top tier of that. And then how you move down those ranks, what that discussion is.
We'd also talk about Board of Ed, teachers.
Board of Ed, I think, would be a natural, and you also have to talk about our hourly employees. As someone in Rec and Parks with those 300 or 400, I'd like to see those included in that county employee. But that's all to be discussed, and we've given ourselves some more time. That would be due in April on the exact going down. And I'll let Robbie speak to how.
Well, I was going to ask, the YMCA is okay with that kind of prioritization?
Yeah, we'd have no issue with that.
Okay, good.
I mean, we're stepping into this space just to try to be a good partner. It's an area that we're comfortable working in. The Wise across the state is the largest provider of childcare in the state of Maryland. So we see it as a natural kind of dovetail with the partnership we have now. So yeah, we have no issue with that at all.
So then, other question for the director, the revenue sharing, this was never really intended to be a revenue generator. Is this revenue sharing forcing our costs higher for usage of the facility? Because there was a goal at one point to potentially be able to offer incentives as.
So we did some benchmarking on community pricing with like providers just to get a better understanding of what the costs look like to build out a budget. To Ray's point, if you don't build out those other two classrooms and to where you have more 3 and 4 year olds, all those spaces are regulated by the state and the number of children you can have in a space. The facility will lose money every year without those spaces at the rates that we looked at.
Not worried about that.
So yeah, they're benchmarked from that standpoint. The YMCA, as with our facility, provides financial assistance, so individuals that would need assistance could get that access. If you wanted to your point though, if you wanted to subsidize that, we'd have to navigate how you fund it.
My question is in regards to the YMCA paying recreation and parks. Is that necessary? Is that needed?
I think it's helpful to offset the ongoing costs related to managing the relationship and the building. It's not, this is definitely I'll call it a below market kind of rate because we've seen this as a service first. Yeah. But childcare is not at the same square footage cost that you would get for regular retail type of thing. So this model is as they succeed in the facility, we see a little more as well, and that money would be available to help, with all sorts of different things. We would have the flexibility to reinvest that in our Rec and Parks programs as I come to you with the budget.
That would be the follow-up question is, what are we doing with that money? Is it earmarked a certain way, or is it just going back in the general fund? Or
there wouldn't be until next fiscal year, so we are including in our budget request what we would if that revenue materializes. But again, remember, up to half of it we would be as cost savings to ourselves for facilities. We'd be able to hopefully expand what we're doing in the world of basketball or other sports like that. So we would be coming back with less of a request to you guys for money because there's no sense passing money back and forth. It's just kind of a trade agreement.
Okay. And then I guess last question, more general YMCA question. I've heard good reports on the building. How's the fundraising going? I haven't seen an update in a while, but how's that going?
Well, a committee of 20-plus volunteers continues to work hard at that on a weekly basis. So we've, in total, secured 19 million towards the 22. So typically we're kind of on pace for where we hope to be with the facility opening in June. We've hired our executive director that'll run the facility.
Oh, good.
She's relocating at the end of the month, and we'll be on site for the beginning in January, and then we'll hire those other staff and prepare to open. But yeah, we're still on pace and feel comfortable we can secure the remaining funds necessary by the end of the year. Our contingency, we set aside about $1 million for contingency. The Metcom thing kind of ate up a third of that that no one was really aware of. But outside of that, we've had a little bit of overruns related to tariff issues and some of our mechanical systems coming out of Canada. But by and large, we're still on budget and on track to stay within the $22 million number.
Good update.
I have a request here. It doesn't directly apply to the MOU, but it would require, I guess, DES and Sheriff's Office and HR to give us a chart of how much lost time we have due to childcare issues, because I get a lot of pushback about why is the county helping do this, and we're going to run private childcares out of business. Well, since COVID, 50% of the childcares in St. Mary's County shut down, have not reopened. And you just had the sheriff up here saying that, sometimes they're understaffed down at the courthouse, they're understaffed on the roads. How much of that is due to, having the childcare issue? Same thing with our 911 call takers. I would like to have information on that eventually. I know that doesn't apply too much to you, Mr. Gill. But I would also have beat this drum since we started this process, is that we start to get a good relationship with CSM to make sure that their early childhood education program students can funnel through there to get their practical applications. Same thing with the ones who are doing their elementary education work over there. And now we have this program at the tech center to start funneling those kids through there. Because if you can find out when a student is 17 years old and a senior year in high school, if they said, I'm going to be a teacher, things change when they get into a classroom, because the highest teachers usually, if they make it past 5 years, they'll stick around for a while, but that first 5 years is really important. And if they have a little bit of exposure before they get into the system, it'll help out. I think that'll help out immensely. So, and plus, we don't know what Blueprint's going to do with pre-K 3, which that over there would be a perfect spot to start implementing it and alleviate some costs.
Yeah, we're expanding our use of interns from the tech center. We're in this next budget, we're requesting some for the golf course that we haven't had before. Museums has some new ones, and we've talked to Robbie about some of the different programs like that we thought could be helpful. So
Good.
Get that pipeline going.
Okay, tell me, you're going to expand it by 2 classrooms and go from 73 or 70 students to 100?
roughly, you'll never know until you have the final say through the state accreditation as they come in for childcare. But yes, there's last 2 rooms. We've also taken input at the YMCA's request, like they thought that they could go with smaller closets in those facilities. So the rooms were, I would call them 80% finished in this first plan.
Okay,
So there was electric to them, there was
So
stubbed
that's
out,
why it's
all
so-
that. That's why it's so
So
cheap.
cheap. Yeah,
Yeah,
okay,
so
I get it. That
to
didn't
me,
make
when I
sense to me.
started as director and I heard that number, I was like, this is a no-brainer, because
It's a
if you have to
no-brainer.
remobilize and you have to do it in the middle of a childcare center where you have to check background, everyone coming and going, we'll never want that.
Mr. Bevins, it's a no-brainer. I
Yes.
mean, I just didn't realize how it would be that cheap to get that much more capacity. That didn't make sense to me.
Yeah, increase 30 people. all of a
I know,
sudden,
that's
30
what I'm
kids.
saying.
Yeah. Wow.
So, Mr. Gill, nice to see you, sir.
Good to see you, sir.
And you say Y is the biggest child care provider in the state of Maryland. How many child care facilities do you think the Y runs? Roughly, not exactly.
Well, so outside of Southern Maryland, which this will be the first Y in Southern Maryland, you have YMCA's located in every county but Somerset County across the state, serving 250,000 folks on a regular basis. But the Y is the largest provider of early childhood Head Start in all of Baltimore County, Baltimore City, and the surrounding area. From a early childhood standpoint, you're talking over 7,000 kids. From an after-school standpoint, across the entire state of Maryland, from the Eastern Shore to Washington County, you're looking at nearly 10,000 kids a day.
Wow, that's a lot. So I would assume, I think it's safe to say you're an expert, or otherwise an expert on doing this.
I would say
Yes,
so,
sir.
yeah.
Yes, sir,
we
and I'm
are.
always a fan of hiring experts or getting associated with experts when we need something done, so I'm very happy to hear this. Now, you said going from 73, I think, to 100 makes a difference in the business model for the facility. Does it turn a profit if it gets full max?
I mean, you're not really, as you guys went into this, you're not really into this to generate net revenue. I mean,
Well,
but
let me interrupt you
but
for-
it goes from being a loser to being able to cover expenses and staff it appropriately. When you're
So it breaks even.
when you're a 3-to-1 for an infant to a staff, and you can only have as many as 6 kids in one space, those early younger ages that you need to make sure you're providing, especially to Commissioner Alderson's point, if you're if I'm trying to hire and recruit young deputies and teachers, and I have infants, having quality care that I can have those kids in is key. So you have to have those. They lose money just because of the ratio in itself. So you have to make sure you have enough space on the back end for the 3- and 4-year-olds, which have a higher number of kids in the ratio that allow the math to work out to balance it out.
It kind of follows your model on swimming pools and your YMCA's. They tend to lose money, but you pick
They're
it
like
up
big
on the other.
boats. Yeah.
You pick it up on the other activities. That's good thinking. So, you're a 501c3 corporation, so you're a nonprofit. You're
Yes,
not
sir.
in this to make money, but you're in it to break even.
Well, yeah, we're in it to serve the community.
Right, okay,
And
okay.
be good stewards of the resources that we're blessed enough to receive. Yes, sir.
All right. Well, pivot to the other question I had for Mr. Bevins. When you want to reorg a existing vacancy, will you want to replace that vacancy when the budget comes up in a couple months?
Well, this is a position we already have, and this was kind of taking your guys' advice where you asked us to look internally. So this is a need we'd like to move on right away, and we could post and get going.
I'm okay with it. Are you going to backfill it with a request for another position when it comes
No,
up?
this is taking that off our list, because it was going to be on the list again next year, because we didn't get it fulfilled in the last budget cycle.
This position was originally intended to support the child care center.
This was the child care position that's there, yes.
All right, reapproved.
I think one other piece of data that we need, that the commissioners need, no real rush on it, but before it opens, obviously, is the ratio of adults to children in the classroom that help. I don't know what the ratios are, but I know it's pretty high for infants, and it goes down as the kids get older. And I'm not sure if the rest of the commissioners do know that, and it's just a good arrow to have in our quiver.
Yeah, those are mandated by the state.
Yeah.
And so you have two components to that. You have the ratio with staff to children, but then you also have a specific amount of square footage that has to be allocated per child. And so you can't, cram kids into a space that's too small. So that's the other key to Ray's point. You have to make sure that you're designing it correctly, because if you miscalculate, as an example, in the infant space where there's a crib sitting there, that square footage that crib is sitting in, that square footage can't be counted. But Commissioner, that's no problem. We're happy to work with Ray to provide that for you.
And I did look, Catherine, Director of Human Resources, will provide that information on sick leave. And I think this is going to be a tremendous hiring asset and recruitment tool, retention.
Oh, totally agree. Tell me about the requirements of your caregivers. We just heard from the Sheriff's Department where he has this lengthy process to.
So qualifications are mandated through the state.
Okay.
And so they have to meet specific qualifications to work within that space, either as an assistant or a teacher.
So you
And
just
so
can't hire somebody who's untrained or got a good heart and wants to do this?
Absolutely not. In many cases, those standards are make hiring relatively difficult, and so you have to work hard to make sure folks that have an interest in that work have opportunities for the training that they need to be able to qualify to work in those spaces.
Is it, well, I'd like to think hopefully there's a class of people or a group of people that you can pick from, but we have some kind of training for people who want to get involved in this.
Oh, absolutely. Yeah, absolutely. Yeah. And you, because of the qualifications that are necessary, you're not going to recruit, attract and retain individuals at minimum wage. You've got to pay more than that to be able to make sure you
Okay.
get the right people.
Okay, well, that makes sense, good.
And there's an extensive background check.
Oh, absolutely.
Correct.
Yes, sir. 100%. Yeah, that's all mandated by the state. So they're fingerprinted and everything else. Yeah. It is highly regulated.
Very good.
All right, in the interest of time, I'm going
And
to
that would be
move.
for anybody. If you were running it or
Christian,
anyone
go
else, all those regulations are the same.
David, on this motion.
I was going to say, I actually know the answer to Commissioner Alderson's question about the financial cost. Comptroller Learman, puts out special advisory reports. She did one about a year ago on childcare, and they based it on a 2018 study that said due to childcare related issues, workers in the, or businesses in the state of Maryland lost on average of I think it was over $1 billion, like 1.2 billion, just in the state of Maryland. So it's an interesting fact that having reliable daycare can certainly help the organization as well as the parents, right?
Well, I'm going to move to
Mr.
approve the
Weisskopf.
MOU.
Oh, I'm sorry, you had a question?
Yeah, on this motion, do we need to add into this motion the additional cost of the 2 rooms of 30,000?
No, because I don't believe,
I have it in the existing budget, so.
He has it
we're-
within
You have it in
just
the existing
deferring
budget?
other projects, yes, so.
Okay, because if this statement here says it's not included, but you say you got it.
Yep.
Okay, never mind.
It is not
Commissioner
new
Hewitt,
money.
Go ahead.
All right, well, I'm going to move to approve the MOU with the YMCA for the operations of the child care and authorize, child care center, and authorize the commissioner president to sign the agreement. I also move to approve the associated position reclassification.
Second.
I have a first and second, all in favor? Aye. Any opposed? Ayes have it. Thank you, Ms. Gill, for being here today.
It's good to see you guys. Y'all have a wonderful holiday. Merry
You
Christmas.
too, now. Merry Christmas.
Merry Christmas, Happy New Year, sir. Next up is the Department of Public Works and Transportation for the Peg Road Roundabout Construction Award Recommendation. Acting Director Donnie Mills approaching, and Procurement Officer Brandon Hayden is in the audience.
Director Mills, that is quite the festive tie you have on, sir. I like that tie.
Thank you. It's my ornaments. All right, Commissioners, we're here requesting approval to issue a purchase order for more than $1 million. Funding for the Peg Road 2-lane roundabout was approved in the FY26 budget and is shown on the HW 2101 capital improvement sheet. That's included in your package. And this project was budgeted for $2.5 million.
Holy smokes, save some money.
Also, there should be a exhibit there in your package of kind of what the roundabout's going to look like. I say kind of, that's what the roundabout will look like. So this PO will be for the construction of the Peg Road roundabout and is intended to streamline the project delivery as well as using less money to construct. The purchase order aligns with the heavy equipment contract that was awarded in March of 2021. In general, so projects that are completed using heavy equipment contract typically come in on or under budget, and we expect the same for this project. DPW will have an inspector present throughout the construction, and the engineering team at the Arnold Building will be ready to assist should we need minor design changes, for to accommodate the construction. Awarding this PO to the heavy equipment contractor will save approximately $1 million on the project. Also, we will be coordinating with public and non-public school buses, STS, and the PIO to keep the public updated on the project. We will be working with all the utility companies for adjustments of vaults and valves and all of those things to accommodate the project. And with that, it's, you know, I'll open it for questions. I'm sure you got some.
So no utilities have been moved yet?
So, yes, no utilities have been moved yet. But we did this design to minimize impacts to almost all of the utilities. There's only a couple. So. Good.
So, more of a question for the county administrator here on this one. So correct me if my memory's wrong, and Commissioner Ostro, you correct me too, but I think that this project specifically came about couple years ago out of some budget public hearings that we had, and community approached us specifically in that area because Peg Road is kind of one of our faster roads, and this is almost of a traffic calming device. It's a dangerous intersection, a lot of children crossing the street and stuff. It's a good project and definitely support this, but I think it was approved in the FY24 budget, and it was intentionally done using fund balance that we had at the time, so we didn't have to wait for bond authority or anything like that. I guess I'm kind of asking, why the delay? Why are we just now
2 years down the road.
approving this to get this going at this point? And I would say, of course I'm gonna, of course, vote to approve it today, but could we take a look at, and maybe sit down and have some real conversations about what's going on with our timelines in order to take us this long to get here for this?
That's one of the big things I'm going to discuss with the new director on Friday.
Okay.
Or bring up with him as his first day of work.
Because we have got to find a way to move some of these projects along quicker.
But I know you're right, this was Westbury neighborhood.
Yeah, it was at the big BWS public hearing at the.
Great Mills.
At Great Mills is when it first came up,
Yeah.
and then they followed up at the second, the same head of the HOA came to the subsequent public hearings here, public forums here too.
And they came to several of my town halls wanting to get this done, and we were able to get together and work this through, so.
We'll have an answer for you.
Well, I think the good news is it's finally
getting
ready
done.
to bid.
Yeah, it's getting done.
I mean, now, what I'm not amazed, but I'm happy to see is this $1 million savings. So that would be the other part. We tend to see some projects that go way over. The Sheriff's Services Support Building, the museum out there in St. Clements Island. They came in way over. And then we get Phase 3B or whatever it is, FDR Boulevard, a couple million under, 3 million under. And then this one's $1 million under. I mean, it's kind of my thought is what's going on. So I'm not asking you to answer that question, Director. I'm just trying to say that, I mean, I see Trading Post, a local company, got it. They also got the last one. Lord knows they must be sharpening their pencil to come in so low. I mean, if I knew I had 2.5 million, I guess you got bids, right? You got bids from other companies?
So on this one, we asked the contractor to provide, the contract's basically time and material. So the county's really only paying for what they get done here. The reason it's here today is because it's more than $1 million. That's the reason we're presenting.
If it had been under $1 million, you wouldn't even need to be here.
Yeah, that's correct. We wouldn't be here. We would be continuing on. So retrofit projects, roundabouts where we have an existing intersection.
Okay.
Those are challenging, as are road extension for FDR. You know, those are challenging. So like one of your first steps is get through the design piece, and then we're looking for the property or getting easements or whatever. So that can take quite a bit of time.
Okay, you're right about that.
And so, you know, with these retrofits that are isolated to a really small spot, we really need to be able to have the flexibility to make adjustments on the fly right now. You know,
But you
because
don't
we're
have
going
to
to have
have-
the road open.
You don't need easements, you don't need to buy
So
property.
we do. That is wrapping up now. We expect that to be completed very soon. There's stormwater associated with this project. because of the additional impervious coverage. Yeah, it's a lot of moving parts, and it's really challenging on these. It doesn't really matter what project it is. Anytime we're adding and needing property, it's, we got to contend with the maintenance of traffic, all of that stuff, because we're not trying to close any sections of this. We're trying to leave it open. However, we might be utilizing, not going to call it detours, but Westbury may need to go out the other side for a term of the construction. But
Look, you make a great point. I remember their former director of DPW&T who said buying the easements for FDR Boulevard from Chancellor's Run to Hewitt Road would take 6 months. It took 3 years.
That's right.
So, I mean, that's why I
Yeah.
think these things take so long, even though I think it's a good idea to understand the process a little bit better. But the key is you're finally here, and congratulations and thank you.
When will this project actually be completed?
So we're talking about, it's scheduled for spring. That may be late spring of '26, and then we're thinking it's a 3-month project.
Good. So it might coincide with FDR Boulevard being finished?
It might.
That'd be a great.
Wouldn't that be something?
That would be awesome.
It would be.
That'd be fantastic. Well, I move to authorize the procurement officer to sign the purchase order in an amount estimated to exceed $1 million under contract number SMC-21-DPWT-112456 for the heavy equipment rental services to construct and complete the Peg Road Roundabout project.
Second.
I have a first and second. All in favor? Aye. Any disapprovals? Ayes have it. Thank you, Mr. Mills.
All right, go get her
Thank
done.
you, sir. Next up from the Department of Finance is the approval of resolution for the realignment of the 2023 bond. Nope, we took that off? Okay. That is all.
That's all. Take it off.
Okay.
Okay. Let's see, we move right into Commissioner's time. We'll start with Commissioner Ostro this time.
Oh, thank you. Well, I want to, first I want to start off by apologizing, Commissioner President Guy, for my tardiness today. It turns out that on Hollywood Road, somebody had a sleigh double parked. Oh, no. And I am absolutely convinced it is one of those Amazon gimmicks for their delivery drivers, but I think they're taking it a little too far now. You know? I'm just saying, so my apologies for my tardiness today. And then I definitely want to make comment on this Peg Road roundabout. It's something that, as Commissioner Colvin brought up, that was brought before us a couple of years ago, and I'm very glad to see this coming to fruition. This is a perfect example of when people bring things to the commissioners. There's a need out in the community, how we're able to get together. We can't always do things because, budget constraints and things like that, but this is one project that we saw that was very badly needed in the community as a safety issue. And this commissioner, for one, is really happy to be able to close the year with this big win. And as Commissioner Hewitt said, it's great that we're coming in with $1 million in savings on this project. So that's a fantastic win, and really excited for this big win for this commissioner and this commissioner body. So moving along, it's been a very busy couple of several days for this commissioner. This past Saturday morning attended the Shop with a Cop program opening at they meet over in Wildwood, and we got to be there in the morning, see the kids, hand out donuts and coffee. The 3 commissioners up here currently were there that morning, and it's always a great morning. I do it every year. As I know, Commissioner Alderson usually cooks for that event every year at the fairgrounds, because that's where we meet for donuts and coffee, and then the kids all get to go lights and sirens down 3-notch to Walmart, where they get to do their shopping with one of our law enforcement professionals, and then they head over to the fairgrounds for a nice big breakfast and gift wrapping, and it's really a wonderful program, and it's the 22nd year it's been going on, 22nd or 23rd year. And it was also my privilege to be able to deliver a certificate. Their treasurer is retiring after 23 years of service to the Shop with the Cop program, so it was my privilege to award a citation to her and the whole program for their outstanding work in this community, and it's always an event that I look forward to. We also do one in right before school starts as well, where, you know, the kids, it's the same thing, and, you know, they get to go get their school supplies. So it's a wonderful program, and I hope to see it continue for many, many more years. It's always something fun. It's something I look forward to very much. And then this past Sunday, I was privileged to be able to play Commissioner Santa for the final time. Well, for the final time this year for the story time and cookies with Santa at the over in Lancaster Park at the Colored Memorial Museum there. We had a wonderful turnout. About 15 or 20 kids came out. It's always a great time. My wife joined me as Mrs. Claus. We always have fun doing that. So that's just one of the things that really make the season special. And then my wife and I have a tradition whenever we go anywhere and do a Santa event. On the way home after we're done, we always stop at one or two of the local grocery stores. So we chose to stop at Walmart after we were done with that and walk through Walmart, and it's just great to see. I've commented on it before. You have the adults that are just as bad as the kids, right? They're screaming Santa, yay, and then you have those adults who purposely will not look in your direction, and they struggle not to. But it's always fun to see the kids, and take pictures with the kids, and even the store employees like it. It kind of brightens their day a little bit, so it's always a fun thing to do, and we enjoy doing that very much. Yesterday, Commissioner Colvin, Commissioner Guy, and I attended the ribbon cutting for the Three Oaks Center Andre Rice Emergency Men's Shelter. That opened. We did the ribbon cutting for that, and that is something that is desperately needed in this community. So, I want to give just one more shout out to all the people involved in bringing that about. A big shout out to Sasha Seneth, the director of Three Oaks Center, and there's a lot of people who've worked very hard to bring that about. So it's great to see that open. It's going to serve this community very well. It's actually a beautiful facility. They did a beautiful job on it, and there must have been, I don't know how many people were there. There were at least 100 people. And it was all those people packed inside that small house was very interesting. And I'm proud to say that there's a big ramp that leads up to it. And I'm proud to say that ramp is built very well, because there were at least 100 people standing on that ramp to take pictures and whatnot. So it's constructed very well. And so that was a great day, and something that much needed for this community. So also, lastly, I just want to mention we're going to be off for the next couple of weeks. Christmas time we're heading to Christmas. If my wife and I and my family, we always do it every year. We always adopt. We're adopting a couple of Marines from the base who don't have anywhere else to go, so they're going to be over at our house Christmas Eve and Christmas Day. I always encourage people, look around. Check with people in your office. Please make sure everybody has a place to go. It's been a privilege of ours to be able to do this for our whole married lives. We've been married for 33 years, and we've always invited people to join us for the holidays if they don't have anywhere to go. It can be a very depressing time for people if you have nowhere to go and no relatives nearby. So please look around, ask around. If you know of anybody, invite them over to your home to share in a meal. We've made some great friends over the years by doing this. So it's one more benefit of it, but I highly encourage people to do that and make sure everybody has some place to be for the holidays. We have a budget work session coming up this afternoon, so tune back in for that as we really start to kick off budget season. So tune back in for that, and I hope everybody has a safe Christmas. If you're somewhere at a party, please, we have a great Uber system in this community. Please call that Uber, go pick up your car in the morning, have a safe Christmas, and we'll see everybody back here this afternoon at 1:30, and then after that, we'll see you all next year. I'm going to pass it on.
Alderson.
All right, well, thank you very much, Commissioner Ostro. Thank you, Commissioner President Guy. I'm a little distracted right now. My phone just went off, and I have something that could be it needs to be paid attention to by everybody who's out there, especially if you online shop. I just got an alert. There's been some dark web activity regarding my personal information. So keep an eye on your credit reports. I'm constantly up here talking about financial literacy. A big part of it is keep an eye on your credit reports. You can get reports for free, and you can always sign up through your credit card companies like I have with a couple of mine to where they constantly monitor my credit. And so just a little FYI, and do a little due diligence to keep your information safe. So Saturday morning, shop at the cop. I woke up Saturday morning and I was beat because everybody knows I work crazy hours on my job outside of here. And my alarm went off. I'm like, man, what am I doing? And then I was like, oh man, I got to go Sling Donuts. So down I went to Wildwood. I thought I was late. Come to find out I was not late. I was indeed early, which is...
You were the first on scene.
No, it wasn't quite the first, but I was the best dressed. If you get a chance to see any of the pictures in that smashing sweater I was wearing, it was both stylish, comfortable, and very utilitarian with this nice pocket right on my stomach hair. So 107 kids, they get $250 each to go shopping, and they definitely go down with the law enforcement. It was St. Mary's County Sheriff's Office, Maryland State Police, public safety from Pax River. Then we had Coast Guard there from St. Inigo's, DNR, fire marshal. If they had a badge or if they were something like that, they were there driving. The Coast Guard guys had to drive their privately owned vehicles. And so there was one really nice sounding Camaro there, a newer Camaro. So I know the kids were digging that. And I did do a video of everybody leaving. Had just the right amount of hot chocolate. It was amazing. I think we ended up with like a half a cup left out of the almost 10 gallons. So that was, and then after that, I went over to the fairgrounds, did the breakfast with them and helped wrap and everything, but I ended up giving myself the job of being basically a maitre d'. I would find an open table and have the kids come in. They would come in with their officers or whatever, drop off their stuff, and go eat. And by the time they came back from eating the hot breakfast, their presents were all wrapped. And as they were leaving, every child walked out with a grocery bag full of groceries for home, along with a loaf of bread and a bag of apples to go home with them. And that was, if it was one deputy with 2 or 3 kids from the same family, 3 bags went. And I want to thank all the Optimist clubs in the county, the state's attorney's office, of course, the Shop at the Cop organization, and all the agencies that were involved. It was an amazing turnout, an amazing event. A little chilly, but it's wintertime. It's supposed to be chilly. And looking forward to doing that again next year. And if you need somebody who's willing to take donations, Shop at the Cop is always willing to take monetary donations because Bill Raditz, who runs the program, was very pleased to be able to give the kids $250 this year as opposed to the usual $200. And I'd like to see him maintain that and maybe bump it up a little bit would be nice. And to help serve more kids would be awesome. Later that day, went to the hospice fundraiser that was held at Sutler Post Farm with the Clydesdales. That's the Mast Farm. And just a great turnout. That's when it was starting to really get cold, that part of the day. But great turnout. I walked away with a couple of things for Christmas. Also left quite a bit of money in the raffle and the silent raffle stuff. And I didn't win anything, but it's all good. And that evening was 7th District Volunteer Fire Department installation. And great thing about that little fire department over there, that 18 new cadets in 18 months. And I think all of them were there at the installation on Saturday evening. Now, they did something a little different where they told all their members to come in casually. You know, I show up, you know, of course, I got a tie on, that's my work clothes. And because I'm, you know, commissioner, you dress for the job. And I'm seeing everybody in flannel shirts and everything, but their turnout, they said, was huge just because they did not have to wear their uniforms. And if that's what it takes to have them come out and enjoy time with each other, you know, so be it, you know. You should, wearing the uniform doesn't make you, not wearing it or wearing it doesn't make you any more or less of a firefighter, especially if you're one of the ones who's being commended. Had Speedy Nelson, got a length of service award for 50 years, 25 years for Mike Gibson. And if you know Mike, you must have think he was probably still wearing diapers when he jumped on his first piece of apparatus, which he probably was because his dad's a member and his son is also a member. So that speaks to what I talk to a lot about up here is how it's generational with all of our volunteer services. It's not uncommon to see a great-grandfather, grandfather, you know, all the way down to the great-grandchildren in the same fire department, which is great. Let me see what else we got going on here. Rucci's grand opening. I've been very excited about this because they make a fantastic Reuben. So Rucci's grand opening is on Monday. Thankfully, I'm going there and I get to help present a proclamation. So hopefully I won't have to wait in a 3-hour-long line like there was for Boone's Bagels on the day that it opened. But that just goes to that just speaks to the enthusiasm our community has for new businesses that actually fit needs, and it's something a little bit out of the norm. So I'm looking forward to that. And spoke earlier about the cold weather, and it was mighty cold Saturday, and it's been cold the past couple nights, and everybody knows that. My pellet stove is out of commission right now, so you're welcome, Smecco. I'm using my heat pump to help heat my house, and it's I haven't heard it shut off in 3 days. It's very disheartening to me. But to a larger and more sobering point is the need for a good hard look by this board and our allied agencies to look for a solution for hypothermia warming centers in the county. We do need a plan. There is a semblance of a plan in place, but it's from the feedback I've gotten over the past 48 hours, it's not that great a plan, and we need to do something to address that. It is a hard topic to talk about, but it is one that needs to be addressed because we are commissioners for all of St. Mary's County, not just the select few. And we do need to look into that. And to that end, I would like for us as a board and as a county government to look into using the Fairlead Academy, if possible, as a warming center. Just a temporary warming center, nothing permanent. Because on nights, we had an issue the other night, there was issue with placing an individual. The air temperature at the time was 22 degrees. That was before the wind chill. And the individual was placed in a shelter that evening, but it shouldn't have gotten to the length, it should have gone to the lengths it went to find a solution. We have the power up here. We have the power within our county government to find solutions, but we do need buy-in from the volunteers and the community to help guide this program, any program that we would advise. We have, like I said, we have a facility that could possibly be used. Now, it's something we need to address earlier in the year as opposed to later in the year. I was thinking maybe we'd do it in September, but I was told that we maybe should probably do this in March. That way we have a plan and everybody knows their roles. But it is something that does affect all of us. It affects all of us as humans. It does this outside of any kind of party affiliation. So we just need to look at this and try to find a solution to help these people. And with that, I want to wish everybody a Merry and safe Christmas. Have a Happy New Year. And remember, when you're out driving, please be courteous, and be patient, and use your turn signals. See you on the 6th.
Eric, you got it.
Very good. Well, I think since it's our last commissioner's time for the year, we've all got a lot of stuff we want to talk about, so I'll see how long I go. But first off, I want to give a shout out to Dolv5880 on YouTube. He or she is currently or has been watching our meeting today from Scotland, and I don't think they mean Scotland, Maryland. I think they mean Scotland over the over the pond. And I'm just like, well, that's exciting. That's good if they're still watching. Thank you for watching and staying informed about what's happening in St. Mary's County. It's been a busy time, as the other commissioner said. The MACO conference last week was interesting. It's always interesting. There's always a lot I can take away from it. I heard a new term that I had never heard before when they were talking about, specifically about housing, but about a lot of the issues that Maryland is facing. They said Maryland has Smith Island cake regulations, meaning that there's layer on top of layer on top of layer of regulations in Maryland. I thought that was a good way to look at it, a good term for it. But there was a lot of talk about energy and data centers, a lot of talk about Blueprint and the state budget. Got a chance to hear the governor's remarks to all of the locally elected officials in the state, and the governor gives a very good speech without a lot of concrete, actionable takeaways from it. He did kind of commit to not raising taxes, but he didn't say anything about not pushing costs down to the locals. So that definitely has us nervous with the state facing a $1.4 billion budget deficit. What are they going to do? In regards to that, they're meeting today. The General Assembly is having a special session today where they are going to be installing a new Speaker of the House and possibly taking up some of the governor's vetoes to override them. There's been a lot of chatter on social media over the past couple days about the commissioners should weigh in on the data center bill that the governor vetoed, that Delegate Crosby had brought forward, and I am happy to see that there's a bipartisan push. My friend Senator Reddy from who's from the Senate, he's the minority whip there, talked about being in favor of looking at data centers closer. And I didn't really enjoy the press release that came out from the local Democrat Central Committee. I didn't really think they worded it fairly because the General Assembly doesn't really take their agenda from us, the commissioners of St. Mary's County, and we don't really have time to send them a letter for when they're meeting today. So I thought that was kind of humorous. But enough of that. Thank you, Commissioner Alderson, for bringing up the homelessness issue, and what Commissioner Ostro talked about with the Three Oaks facility yesterday was a really good ribbon cutting, and definitely a lot of conversation over the past couple days about some of the more difficult challenges we're facing as a community, especially in the extreme cold weather. And I do think there's some work that we can do as county government to assist the community with that. Over the weekend, I was able to attend the Ridge Volunteer Rescue Squad installation. It was a great evening. They did a great job. Shout out to Commissioner Alderson's mom, who let me sit with her. She is an avid watcher of our meetings too. I don't know if she's watching today, but it was a very good conversation with her. And then I was also able to attend the 2nd District Volunteer Fire Department Rescue Squad's tree lighting in Valley Lee. It was a wonderful, fun time. They did a great job with that. And then on Sunday was able to attend the Cosmic Symphony concert, and they had the St. Mary's Choral Arts Group in there with them. Sold out, full house, sold out free tickets, but every seat taken. It was a great concert. The Cosmic Symphony always does a good job, and it was a lot of fun. So thank you to them for putting that on, and I hope everyone has a great holiday season and look forward to getting back to work in the new year. Thank you.
Commissioner Hewitt.
Hey, thank you. Well, I want to pick up real quick on the YMCA today and their MOU to run our child care center. I'm glad that I ran into Robbie Gill, be a little over, I guess, 7 years ago in Easton, and it was the start of a beautiful relationship. I think they're the experts on running recs and parks things, specifically YMCAs and swimming pools, which are very expensive. And now we're here in child care. It's a good public-private partnership. They're a nonprofit. It's not like they're out there trying to make money, but they are providing a service, so I'm glad to see that. I'd like to chime in too about MACO. I found a couple interesting sessions out there, and one was on affordable housing. And there was a program that Frederick County put forth. I talked to their land use director afterwards, where they were taking county land and putting out for RFPs with builders to build what I would call rent-controlled units. They have to, the people who get these awards obviously save on the money it costs to buy the property. They get some kind of breaks on the impact fees or the excise tax. They also get some other, what's the term, relief of government regulation to put these in. But they have to provide these apartments at affordable rates, which who knows what that is. But a one-bedroom, I was talking to him, would go around between $1,000 to $1,100, a two-bedroom around $1,500, and a three-bedroom around $1,900. The point is, it's a good idea. And what they do, they try to make it available to, young professionals. They have to be open about it, of course. But it's a good idea. And the county, this county has a lot of similar properties that may qualify for a similar type program. So I'm a big fan is I don't need to invent the wheel, just need to watch it roll, and then I can copy it. But that might be an idea worth looking into as far as trying to provide more affordable housing. I also had a session on the blueprint, and I was interested to hear that the blueprint, even though St. Mary's County is well ahead of what the blueprint requires us to fund. We're actually at 2031, almost 2032 levels. But it doesn't include transportation, safety and security, and other items that need to be factored in. So that was an interesting piece of information. I've heard it from the superintendent. It was nice to hear it from another source that, again, I'll use the term independent third party that confirmed it, and it'll change this commissioner's thought process going forward. Now, I got a call the other day from a resident who lives on Blacksmith Road. And it's part of the part that the town of Leonardtown wants to annex property that's currently in St. Mary's County. They want to annex it into the town of Leonardtown. And they have plans to let Quality Built Homes, a very reputable builder, build 215 or 275, over 200 homes on that property. And his point was, he lives on a family farm belonging to his father, his grandfather, been in the family a long time. And he said, the meadows at Town Run, which are on Route 245, they back up to his farm on one side. And he said, they put up a fence, kind of helped him a little bit with any encroachment that went into his farm. But now the one that wants to go on Blacksmith Road is going to come in from the other side. He said he's being squeezed by this development. Now, we're hearing that a lot, that this county is overdeveloping. It's developing too fast. We've heard from people in the northern part that talk about the number of gas stations that get approved. Now, I'm a fan of, if we have zoning regulations, people are allowed to follow the rules and are allowed to do with their property what those regulations allow. But what's happening with the town of Leonardtown is a little concerning to me. What they're doing is they're annexing property that used to be county property that was subject to the septic bill of 2012, which only allowed 7 lots maximum on a piece of property. And now they're turning it into hundreds of lots because they have a water and sewer facility, or actually a sewer facility. Now, what makes it even worse, in my opinion, actually outrageous, is Leonardtown does not charge the excise tax that the county charges everybody else who builds a house, whether it be in Mechanicsville, Hollywood, Tall Timbers, anywhere else in this county. If you build a house or you buy a house that has the impact fee or the excise tax, added to the price, you're going to pay almost $6,700 more. Now, Leonardtown, let me back up. In 2023, July 1st of 2023, the county went from an impact fee to an excise tax. It allowed us more flexibility. It allowed us the ability to fund the sheriff's department, public safety, obviously schools, recs and parks, roads. And those are impacts that when you build a new house or you build a subdivision that are impacted in this county. Now, Leonardtown won't charge it. And in a recent meeting with them, they said they didn't agree with it. And because of the way the law is written, that the permits that come through the county are subject to that fee, their permits come through the town of Leonardtown. So they're not going to pay it. It's not fair. It's not fair to the rest of the residents that they pay that fee. But if you happen to buy a house in Leonardtown, which is not affordable housing, they're doing townhouses now that are over $400,000 for a townhouse. The single-family homes, which they project that they'll build over 1,000 over the next 8 to 10 years, are going to be in the $500,000 to $600,000 range. That's not affordable housing. And it's not fair that when those houses are built, they don't pay an excise tax or an impact fee to the county. And what also is confusing to this commissioner is, look, we built a jail. We renovated our jail. The town of Leonardtown charged the county $426,000 plus impact fee, and we paid it. When we built the library and we built the Garvey Center, they charged us nearly $120,000 impact fee, and we paid it. But they don't think they should pay anything to the county. Now, since July 1st to 2023, that amount comes to just under $200,000. If they build another 1,000, 1,100 homes and refuse to pay that fee, it'll be $7 to $8 million that people aren't paying. Now, rest assured, once people buy a house anywhere in this county, they pay property tax, and that does come to the county, and it pays schools. But there's over 1,000 kids from the town of Leonardtown that attend our schools, and Leonardtown pays zero impact fee when they allow a new house to be built. It's not fair. It needs to be figured out. So that's something that this commissioner, and hopefully all the commissioners, will be concerned about. Hopefully have a meeting with the town of Leonardtown to understand their reasoning behind it. It's something that needs to be worked out. But I think it's totally outrageous. I didn't know about it till about 6 weeks ago. I'd always thought whenever you built a house in the town of Leonardtown, you paid the impact fee or the excise tax. It just amazes me that they didn't pay it just because they don't want to. Now, move on. 7th District Fire Department installation, great night. Now, Commissioner Alderson's correct. The number of those cadets, these young people, teenagers, it was great to see that many young people getting involved. So, hey, let's hope that's continuing across the board. Now, the last thing I want to talk about is a somber note. A man, George Thompson, passed away this past week. Wonderful person. He was a member of the Hollywood Volunteer Fire Department for 61 years. And prior to that, he had been a member of the 7th District Volunteer Fire Department for 7 years. Now, he was well into his 80s. He was an elderly gentleman, but he was a wonderful man. And he is decorated in the fire community. He'll be sorely missed, and Lord knows our thoughts go out to his wife and family and friends. Lord knows it's a big loss for the county. But rest in peace, George Thompson. Now, finally, Merry Christmas and Happy New Year. Thank you.
Thank you, Mike. I want to thank all those out there. I know this is Christmas time, and as far as a member of the Lions Club here in Leonardtown, one of the things we do is this Christmas curing program. We, our Lions, my fellow Lions, and 12 other individuals in the community bought gifts or presents for 47 children that truly are in need. It made their Christmas, and it was really rewarding. Even though it was really, really cold Sunday, we were there delivering these to give some of them. And some things that you just don't think about. One lady called us up and said, I can't get there. I can't even put gas in my car. She says, I'm saving dollars to try to get there, but I just can't get there. And I said, don't worry, I'll be there to deliver them. And we had her gifts delivered. But the ones that picked them up, you could tell that they were so grateful and so much in need. One lady looked at the table, we had all our gifts on, said, these are all for your kids. She just busted out crying. And we tried to help, said, this is a gift from our community. We want your kids to have a good Christmas. We want your Christmas to be not eventful like it's been. Obviously, your need here, and we're taking care of that. And she said, you got everything that we asked for. I said, well, I'm going to thank those who are good, went out there and bought these kids, these children, these gifts, these clothes, the toys. Thank you very so much for your generosity. Also, another thing hit me on this health department thing was the 20% plus individuals in our community that are actually receiving Medicaid. That tells you some of the people that can't afford other insurance, and it's amazing. And I talked to the lady who runs St. Mary's Caring about her situation as far as what's left in her shelter there. We like to call it the soup kitchen, but she said since that the government shut down, but that wasn't all part of it, but she said that we provided some free transportation. You never think about a couple of dollars, but she said it was a big increase of that bus coming by and dropping all these people off. She is now feeding over 100 people a day at her soup kitchen, as we call it, St. Mary's Caring. And it's put a really strain on it, and I would say to all of you, please do something to help her out. Christine's has done a fantastic job, but to say now she's feeding 100 people a day, and of course we provide free transportation for a lot of people that are not showing up there. Also, we just came back from Mako this past week, and I want to put a shout out to not only Mako, but the people who gave me a tremendous award this past week. It was a public service award from the University of Maryland and Mako. And it's been my participation in public service all my life, and also being a part of Mako's board of directors and legislative services. And I'm more than happy to do that. I think Mako does a hell of a job to help us out in the county to try to streamline some of these bills that come down from Annapolis and help us to live with some of these bills and regulations. Like I said, we talked about the Smith Island cake. There's no doubt there's just too many layers and too much to pay for. But with that being said, I need a motion to move into closed session. And Merry Christmas to everybody.
I move to enter into closed session to discuss legal advice.
Second.
I have a first and a second. All in favor?
Aye.
Any opposed? Ayes have it.